All right, today we're going to pull back the curtain on a really powerful medication called Macitentan. It's an absolutely crucial therapy for a serious lung condition that puts a ton of strain on the heart, and we're going to break down exactly how it works and why it's been such a game changer.
But let's start with a question, just to get us thinking. What do you think happens when pressure starts building up inside the blood vessels of your lungs? I mean, imagine a plumbing system that's under way too much stress. The consequences can be pretty severe, right?
And that leads us right into our first topic, the problem of pulmonary arterial hypertension, or PAH for short. You know, the easiest way to picture this disease is to think of a dangerous, nonstop traffic jam happening inside the arteries of your lungs. So what is PAH really? Well, it's a severe and progressive disease. High blood pressure builds up in the arteries that go from your heart to your lungs, and that basically forces the right side of your heart into overdrive, 24/7. And over time, that constant immense strain can cause the heart to fail. That's the real danger. So what's causing this high-pressure traffic jam in the first place? Well, it turns out that in people with PAH, the body is making way too much of one specific molecule. This molecule is the main culprit, and it's called endothelin 1. Understanding this little guy is the key to understanding the whole disease.
So this excess endothelin 1 launches a devastating three-pronged attack. First, vasoconstriction. It literally squeezes the blood vessels, making them tighter and narrower. Second, inflammation. It actually damages the lining of those vessels. And third, cell proliferation. It causes the walls of the arteries to get thicker and stiffer. It's this nasty combination that sends the pressure skyrocketing.
Okay, so if endothelin 1 is our villain, how do we fight back? Well, that's where Macitentan comes in. It was specifically designed to create a very targeted blockade against this one harmful molecule. Macitentan belongs to a class of drugs called endothelin receptor antagonists, or ERAs. The best way to think of it is like a shield. See, the cells in your blood vessels have these little docking spots, receptors, just waiting for endothelin 1 to land. Macitentan's job is to get there first, plant itself on those docking spots, and physically block endothelin 1 from delivering its harmful signals. And here's where you can really see the difference it makes. It's like night and day. On one side, you have endothelin 1 binding freely, sending out those constrict and grow signals that lead to high pressure. But on the other side, with Macitentan's blockade in place, those signals just can't get through. The results? The arteries can stay more relaxed and open. Now, what's cool is that not all shields are created equal. Macitentan was specifically designed to get deep into the tissue of the blood vessel walls, giving it a really long-lasting effect. And get this, when your body processes it, it actually creates another active substance that also does the same job. It's this 1-2 punch that makes it so effective and allows for a simple once-a-day pill. Look, a drug can sound great on paper, but you need proof, right? Cold, hard evidence. And for Macitentan, that proof came from a landmark clinical trial called the Seraphim study, which really established it as a go-to therapy. This trial was a huge deal, and here's why. A lot of older studies just looked at short-term things like whether a patient could walk a little farther on a treadmill. But Seraphim focused on what really matters, morbidity and mortality. Basically, they asked the most important question. Does this drug actually stop the disease from getting worse and keep people alive and out of the hospital over the long run? And the results? They were absolutely massive. Macitentan didn't just help with symptoms. It significantly cut the risk of the disease getting worse or leading to death. It improved exercise capacity, sure, but most importantly, it actually slowed down the progression of PAH itself. This study proved the drug could deliver on those critical, long-term outcomes. Okay, we need to pause here for a second, because with a drug this powerful, there are some incredibly serious safety rules. I really need you to listen closely to this next part, because it is absolutely critical. This isn't something to take lightly. This medication carries one of the most serious warnings you can get from health authorities. Pay very close attention. This is what's known as a boxed warning from the FDA. That's their highest level of alert. It says, and I'm quoting directly, Macitentan is highly likely to cause severe birth defects and fetal loss. For this reason, it is absolutely forbidden to be used during pregnancy, period. So, to prevent this from ever happening, there's a super strict safety program in place called a REMS. And when I say strict, I mean zero wiggle room. For any patient who could become pregnant, the rules are non-negotiable. You need negative pregnancy tests before you start, every single month during treatment, and again 1 month after you stop. And using 2 reliable forms of birth control is mandatory the entire time. Now, besides that huge pregnancy risk, doctors are also on the lookout for a few other things. They need to monitor for potential liver injury, a drop in red blood cells, which is called anemia, and fluid retention, which might show up as swelling. All of this is managed with regular checkups and blood tests.
All right, so now that we understand how it works and its really critical safety profile, let's zoom back out. Where does Macitentan actually fit into the bigger picture of treating PAH? Well, it's truly become a cornerstone therapy.
So when doctors treat PAH, they're basically working with 3 different toolkits, each one targeting a different problem area. You've got the ERAs, like Macitentan, which block that endothelin 1 pathway we've been talking about. It's an oral, once-a-day foundational drug. Then you have PDE5 inhibitors, which work on a different path, and they're often used together with ERAs. And for more severe disease, there are prostacyclin agents, which hit a 3rd pathway, but are often way more complex to administer.
So here's the bottom line. Macitentan isn't just an option anymore. Because it's a simple pill, and because it's been proven to actually pump the brakes on the disease itself, it has become a true cornerstone therapy. For a lot of patients, it's the very first treatment they start on.
And that really leaves us with a fascinating question for the future. We know that treating PAH often requires using multiple drugs to hit those different pathways. So the big question is, now that Macitentan is established as this foundational therapy, how is it going to shape the way new and better combination treatments are developed for patients battling this disease? It's definitely something to keep an eye on.